Sperm freezing is used to treat men as a way of preserving their fertility for use in future treatments so that they can start a family later in life. Sperm is relatively easily frozen and thawed later for use in treatment. Generally, there is no significant loss in the fertility potential of the sample while in storage, since it contains millions of sperm, and only one viable sperm is needed to fertilize an oocyte. If you proceed, your consultant can explain the procedure and risks in more detail during your consultation. So why do men freeze sperm? Some men choose to freeze their sperm for medical reasons, e.g. they have been diagnosed with cancer or another serious illness, and the condition or its treatment, exchangeable radiotherapy, risks their future healthy sperm production. Other men freeze their sperm to preserve fertility potential in the following circumstances. For example, if they are about to undergo a vasectomy procedure, but are keen to have a backup plan, or they are diagnosed with a low or deteriorating quality of sperm, or if they are in a profession in which there is a significant risk of a serious compromise to their ability to make sperm. Or less commonly, if they fear they may not be able to make a sperm sample on the day of egg collection during. Sperm and eggs are stored in liquid nitrogen with other samples to maintain their viability. There's a very small risk that viruses in one sample might contaminate the liquid nitrogen and another sample within it. To minimize this risk, a man will be screened for HIV 1 and 2, hepatitis B, hepatitis pathogen C and, if indicated, hepatoviral and other infections to which they may have been exposed during recent travel. This ensures that stored sperm samples do not contain the most prevalent and dangerous blood-borne viruses. It also means, however, that there is a small but finite possibility that screening tests identify an infection unknown to a potential sperm store. If this happens with consent, we refer you, the storer, for treatment at a suitable infectious diseases clinic. We will also refer you to a fertility clinic which can provide sperm storage, since Acorn Fertility do not have the facilities to store sperm from infected men. So what happens on the day of sperm freezing? Your sperm sample will need to be produced on our premises so that it can be frozen within an hour of production to ensure minimal deterioration. If producing on site is difficult, we will provide you with a sterile container labeled with your full name, date of birth and registration number into which you can produce your semen sample at home. You must bring the sample into Acorn Fertility within an hour of production. Whether producing your sample at Acorn Fertility or at home, you must complete a semen production form to accompany the sample. We recommend 2-3 days of abstinence before producing your sample to ensure a good quality sample. Men who find it challenging to produce a sample via masturbation can attempt natural intercourse using a special condom we will provide you. When attending the clinic, please avoid using strong aftershaves and scented soaps because these products release chemicals which can be harmful to sperm or eggs and even embryos in culture, even in low concentration. So what do we use your frozen sperm for treatment? When you decide to thaw and use your stored sperm, your partner will need to undergo fertility treatment, either intrauterine insemination or in vitro fertilization and viral replacement. If your sperm is not of optimum quality, you will be offered IVF with intracytoplasmic sperm injection treatment. Once your sperm sample is thawed, it will be used in the same way as fresh sperm and as such have an equal chance of producing a live birth. So what are the chances of success? If we have frozen good quality sperm, the chances of a live birth after treatment with the thawed sperm should not differ significantly from the success rate using fresh sperm. This rate is approximately 10 to 15% chance of live baby following intrauterine insemination treatment, of 31% chance of a live baby following IVF treatment. This average success rate is derived from the overall treated population at all UK clinics in 2022, as published by the Human Embryology and Fertilization Authority. An individual's chances of success will, however, vary depending on patient characteristics such as age, past history, and so on. For For patients aged 18 to 34 years, the success is 34%. For those who are 38 to 39 years old, it is 18%. Those patients who are 43 or 44 years old, the success is only 5%. So it is important to discuss your individual circumstances with your clinicians at Acorn Fertility. Are there any side effects or risks? Sperm freezing is safe. We are unaware of any risks to patients or children born from using frozen sperm. Not all sperm survive the freezing and thawing process, but in virtually all cases, excepting those with significant male factor infertility, plenty of sperm survive, allowing fertility treatment to progress. You may be concerned if your sperm will survive the very low storage temperatures. It is true that not all sperm will survive the freezing and thawing, but generally, if the sperm quality is reasonable, most should freeze and thaw process well. We always carry out a test thaw to determine the proportion of sperm surviving the freeze and thaw process for each sample stored. We will advise you if your samples are more susceptible than normal to the process. If they are, you may need to store multiple samples over a period of time to make sure that you will have enough surviving sperm for use in treatment. Let's talk about how we store your sperm safely. To reduce the risk of cross-contamination, only samples from men with negative infection. Screening tests will share a storage dewar. This is why we take blood samples from providers to test for HIV and 2 and hepatitis B and C before storing any samples. In addition, every sperm sample is stored in a closed vial, reducing the risks of cross-contamination still further. In an emergency, sperm samples can be stored from unscreened patients. However, these samples are stored in a quarantine dewar with other untested samples, never with samples from providers with negative screening test results. If you do not have a partner, now complete the GS consent form. Then when you do have a partner with whom you will want to undertake fertility treatment, you must contact Acorn Fertility so that you can complete an MMC consent form naming your partner and consent to ongoing storage and also to the use of your sperm in your partner's treatment. A gameter provider has the right at any time to withdraw or vary a consent to storage. For example, it may be that in the future your relationship with your treatment partner breaks down and you no longer want to consent to them using your sperm in treatment. You may have a new partner you wish to be treated. Alternatively, you may decide to not use your sperm in treatment and, rather than withdrawing your consent to storage and discarding your sperm, you may want to have your sperm used in another way. For example, in donation for use in the treatment of others, for use in training of embryologists, or for use in a research project. You can initiate such consent variations or withdrawals by contacting the Acorn Fertility embryology team so that we can provide you with suitable advice and information, counseling if necessary, and an opportunity to formally document the consent withdrawal or variation. Let's talk about the consented storage period and renewal. HEFE rules dictate that you can consent to store your sperm for later use in treatment for up to 10 years at a time for a maximum of 55 years. You must keep us informed of your address and other contact details in future because we must contact you to arrange for you to extend your consent to storage if it ends before the initial 10-year storage period. If you initially consented to 10-year storage, by law immediately before 9 years of storage has elapsed, we must contact you to initiate the statutory storage consent renewal process. In either situation, if we cannot contact you, you will not be able to provide consent to storage for a further period. Without your consent to storage, your frozen sperm will become unlawfully stored and will need to be destroyed, either immediately if you consented to an initial period of less than 10 years storage, or after 6 months or 1 year for embryos, if you consented to storage for an initial period of 10 years. So please keep in touch with us about all future changes to your address so we can make sure that your consent to storage is always in place. Sperm or embryos created from the sperm posthumously or after the sperm provider has lost capacity, stored under a consent to storage due to mental incapacity or death, can be stored from the date on which death is certified or loss of mental capacity is diagnosed for up to 10 years. If stored for use in treatment or for 55 years, total storage. If stored for donation for the treatment of others or for training. If not used at the end of these storage periods, the sperm or embryos must be withdrawn from storage and allowed to perish, spare immediately, embryos after a period of up to 6 months unless the other gamete provider withdraws their consent to storage at an earlier time. We will contact the other gamete providers 12 months before the end of the storage period to advise them of the disposal timetable for the samples. Embryo storage needs the consent of both gamete providers, so if the other gamete provider withdraws consent to storage of embryos at any time after the death or loss of capacity of the sperm provider, the stored embryos must be discarded. If sperm stored posthumously is successfully used to treat the provider's partner, it is possible for the partner to register the deceased sperm provider as the parent of the child resulting from the treatment, as long as the sperm provider consented to this when completing the MET form which recorded the posthumous storage and treatment consent. Lastly, about payment of invoices. Sperm storage services are provided to you under the terms of your service contract with Acorn Fertility. As such, you must pay the annual fees for our storage services. If you do not pay these fees within the required timescale, we are under no obligation to provide storage services. So your stored sperm will be removed from storage and allowed to perish, even if you have documented consent to storage. Our provision of storage services under your service contract is independent of the storage consent process, and storage consent periods must not be linked to storage fees payment. Storage consent is your permission for us to store your sperm, but we do not have to do so if you have not paid your storage service fees and are not meeting the terms of the service contract. This is another good reason to keep Acorn Fertility updated with your current contact details so that you will receive invoices which we send. If you have moved and not advised us of your new address, you will not receive our invoice for storage services, so may not pay the fees, running the risk that your samples will be removed from storage and allowed to perish. If you have any questions about sperm freezing, please discuss them with your patient coordinator, clinician or embryologist.